attributes do you have that would make a good doctor? I've got big muscles, so as per the GMC guidelines, I can show compassionate care to the nurses. See, I'm actually winking, but you can't tell because I've got sunglasses on. I'm really kind and caring and compassionate and empathetic and loving
Hey, sweetness.
and charitable. There are a plethora of attributes you need to be a good doctor. We don't have time to go through every single one of them, but I'll go through the ones that I think are the most important. First is empathy. When doctors interact with patients, they don't treat them as alienated, isolated individuals. They need to understand them and be able to put themselves in their shoes. When I was talking to a 96-year-old suffering from vascular dementia in a care home, I was struggling initially in the first phases to really understand how I could relate with this person. I had to elevate my speech because he was elderly, so he wasn't able to listen. Then as I continued talking to him, I found out that we had many things in common. I really enjoyed the fact that he had so many experiences to dwell upon. For example, he went to the same grammar school as I went to. But then when I took a step back, self-reflected, I realized that, look, dementia is a neurodegenerative disease that can happen to anyone. Another attribute that I think is fundamental for a doctor, and this sort of ties in with empathy as well, is being a good communicator. You need to be able to articulate to patients, and you need to be able to articulate to a multidisciplinary team and convey your ideas succinctly and clearly. I think I demonstrated this to a competent manner when I was mentoring the lower years in my secondary school. Sometimes when they were struggling, you sometimes think to yourself, oh, why aren't you understanding this? But then when you take a step back and self-reflect, you need to realize that, look, I was also once in their shoes. I was once in the lower years. I once struggled on concepts that I now find painfully easy as well. Being empathetic and being a good communicator in the sense that I can refine my terminology to make it easier to digest for someone in the lower years may replicate an attribute that's fundamental for a good doctor, since being a good communicator will dictate how they take the patient histories, how they articulate to patients, how they deliver holistic care. So we talked about good communicator and we talked about an empathetic person. Now I want to talk about a resilient person. A doctor needs to have both intellectual resilience and physical resilience. I think I illustrated both of these to a suitable competence. For physical resilience, I went on a Gold Duke of Edinburgh award to the Scottish Highlands for 5 days with a bunch of close friends. Halfway through, one of my friends fell in a hole, twisted his ankle, and he had to be hoisted out of the Scottish Highlands by 10 people that came holding a stretcher. This is a real story. The whole morale of our group was really low after that, but through my communication and resilience, I was like, look, just a minor setback shouldn't dictate the entire trajectory of our Duke of Edinburgh award.